everyone. Good evening. Today we are talking about MRCS OSCE, and we will give you a quick orientation about the exam format, how to pass from the first go by harvesting the knowledge and the skills in 3 months. So first of all, the stations need to be clear for you. So for example, you need to understand that each station got a start. For example, the anatomy has a specific build-up from the Royal College of Surgeons. For example, they will start by bone, then ligamentary structures, then muscular regions like triangles, fossae like popliteal fossa, inguinal triangle, Hasselbalch triangle, or femoral triangle, or canals, or hiatuses, and then they will build up neurovascular structures, neurovascular injury, the common injuries known to you, and then the floor and the roof of each region, and then the dermatomes. So the interactive sessions are a must. Like, you must study with a colleague, you must study daily, and the exam format is as follows: 3 anatomy, 2 pathology, and 3 critical care stations. So the knowledge section, you have 3 anatomy stations, 2 pathology stations, and the 3 critical care stations. This is called knowledge section. The section of the skills, you have history taking skills, physical examination skills, procedure skills, and you have communication skills 2, plus 2 preparatory stations for each communication skills, and I will give comment on that. These are the total stations: 2 history taking, 3 examinations, 2 procedures, 2 communication. So in order to pass from the first go, you have 3 types of grades: pass, borderline pass, and fail. Okay? So in order to pass from the first go, you need to have bulk in each station. And 1 anatomy station fail, total fail, will not fail you. 2 pathology stations, or 1 pathology and 1 critical stations made bad, are not able to fail you. So my first recommendation for you is to go for each station as if it is a separate exam. So you finish anatomy, go for rest station, for example, you rest 9 minutes. Don't think about anything. Okay, I have done bad, revise with your colleagues. You met your colleague in the corridor, don't revise with them. Please don't revise, and don't make any station affect your performance in the next station. So I will give you quick orientation about the knowledge section first, and then the skills section. Knowledge, 3 anatomy stations, 2 pathology, 3 critical cares. Sometimes 2 anatomy, 3 critical care, whatever. But you need to think about anatomy is easy pickable. Pathology is the most forgettable part. Critical care, you need someone with knowledge in the NICE guidelines to guide you about how examiners in the UK think. Okay? For example, don't think that critical care station is just about, okay, I will give airway, breathing, circulation, blah, blah, blah. No. There is tips and the tricks. And you need someone who has finished care of the critically ill surgical patient protocol course. In order to guide you, he should got the knowledge from Royal College examiners. For example, how you approach AAA rupture coming to you in the A&E as a referral. Okay, I will go do ABCD approach. Wrong. Okay, I will talk to the vascular. Wrong. Think about SPIES. SPIES means that you think about the scenario, prioritize, identify and initiative, and then escalate and support. So first, you need to tell your examiner in the critical care stations for esophageal hemorrhage, like massive hematemesis or massive upper or lower GI bleed, or this case of AAA rupture, you need to say that this is a critically unwell surgical patient that will require to be seen first and by myself, and patient prioritization need to be ensured, patient safety, and then I will go and see this patient in a safe environment and start my initiative using care of the critically ill surgical patient protocol in airway, and then you will continue as per CRISP, CCrISP. And then I will ensure that I escalated to my on-call consultant, to the vascular on-call consultant as well, senior members of the team, theater team, and organize local MDT that involve ITU registrar and anesthetist, etc., etc. I will talk about this in the hands-on. And then I will ensure that everyone is supported in the team and everyone is competent about what he is doing. And I will reflect on this challenging scenario in my portfolio. Thank you so much. Then you harvest how to make a decision alone. You can't, right? You can't say, I will give airway, I will start managing airway, I will. You can't do everything alone. And this was before my ST3 interview, I was literally ignorant. Even with the CRISP course, little knowledge still. But when I tried how the interview is run, I successfully understood the idea of use the available resources, identify that this is a critically unwell surgical patient, etc., etc. So it's not about critical care scenario, but it is about how to manage the whole hospital. You have ward round, then how to leave it. Should you leave the ward round and go to the A&E patient, or should you wait? These are red flags. The examiner is looking to you. Am I safe to leave this registrar in the hospital and go home, sleep well, or he will make a lot of trouble? Okay, so we'll start first. So you will be divided into two groups, one group for knowledge and one group for skills. In the beginning of the day, there will be registration about half an hour, and some people will go to circuit knowledge circuit, and some people will go to skills circuit. So if you are in the group of knowledge, you will start seeing 3 anatomy stations, then 2 pathology stations, and 3 critical care stations. So in the beginning, you have 10 minutes for each station. For example, you and your colleagues are in the corridor and there are British Council or Royal College organizers, just guys or gentlemen or women are in the gentlemen in the organizers are in the corridor. So when you hear that voice, then you go and read the scenario in front of the room. Again, when you hear this voice, you will go in 1 minute and read small scenario. Okay, that is if it is a critical care scenario. But if it is anatomy, if it is pathology or critical care, you read a scenario in 1 minute. Then you enter, you go in. Okay, so the door will open and you enter and sit on this chair in front of this examiner, and you will spend 9 minutes. Please be brief in your answer. Don't show that you know before he talks. from the courses, from the notes available, from the records, you are going to answer before he asks that. That's wrong. Be brief. Why be brief? Because I got 19 questions as an examiner for you to solve in 9 minutes. But you take a lot of time in question number 1 and 2. So how would I say, hurry up, hurry up? I will not say, I will leave you. This is tip number 1. So be brief, because the challenge is to finish the whole station till the end. All right? Number 2 tip. When you have a question that you don't know, skip it. Say, I will skip that question. And if you have pen and paper, you can write skipped 1. And if this question was dependent question on the following one, and you answered it, for example, axillary nerve, surgical neck of a humerus fracture, you say, I don't know, skip. Then he said, what is the axillary nerve supplies? So you can't say deltoid anterior minor and badge area, dermatome, and then come back and say, can I answer the previous question? Axillary nerve is you can't. So when you finish, don't be panic. You have a lot of questions still. When you finish, tell him, I skipped the question. I know if it is dependent, please, can you give me any other question in anatomy? Give me a chance, please. He can give you the chance. So again, when you have this bill, you have 1 minute to read a station if it is a critical care or pathology, but if it's anatomy, you will go in and enter and sit in front of the examiner. This is the knowledge. Once you finished all knowledge stations, one anatomy, one pathology, okay, till the end, you go to skills. And skills, any skill kills. Means that like we fail from skills, not knowledge. So my recommendation is to intermix your knowledge with skills. Reda, but why we study anatomy in your course and then we go to history taking? What is the relation between history taking and anatomy? Okay, I'm asking you the same question. What is the relation between anatomy and pathology? There is no. I know there is sophisticated blah, 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 but still, there is no, in the OSCE exam, there is no relation. So my recommendation is to start studying anatomy, then history taking, pathology, examination, critical care procedure skills, and then communication. Why? Because you usually study these in 2 or 3 months and you leave 1 month this at the end, but that's wrong. Because this is more important than this. So you need to intermix study as per my schedule in the course. So same, if it is history taking station, you will have 10 minutes each station. 1 minute to read the stem. When the bell rings, then you go in, and then you will sit here, and in history taking, you will have pen and paper to write the stem and talk to the patient in front of examiner and layman for assessing your knowledge with the patient. If it is medical terms, blah, blah, blah. Okay. If it is skills, you have 1 minute to read, 9 minutes in, and the 9 minutes here are divided in history and examination into 6 minutes with the patient. And after you finish examination or history taking, you will sit with the examiner for what? For 3 minutes questions. And the questions are well known. What's present your case? What are your top differentials? What is the treatment? Or what is the management? Management includes treatment, investigation, and the treatment. Okay, so again, 1 minute to read and 9 minutes inside the station. 9 minutes are divided into 6 minutes with the patient and 3 minutes to talk to the examiner. The questions are: present your case. What are your top differentials? What is the management that includes investigations and treatment? Examination, same. Read STEM in 1 minute, go in for 1 minute, for 6 minutes with the patient to start the examination, and then you come back to sit here in front of the examiner to ask you the same as history taking. In communication skills, you have 2 stations. One station with a folder for 9 minutes inside the empty room with folder to read all the case. Who are you? What's your job description in the hospital? What is the name of the hospital? What's your patient? Who is your patient? What is the details, full imaging and laboratory investigations, background and situation? And then what is the recommendation? Who are you going to talk to? And there is a SBAR form you need to follow to hand over this patient to any consultant. SBAR means situation, background, assessment, and recommendation. Okay, so communication skills, you have 2 stations, but for each station you have another preparatory station. So you go empty room, you will find folder for the patient. After you finish the 9 minutes, write everything you want to write, and then go to the other room. You will find either patient, relative, or phone call, curtain in, and the behind the curtain there is examiner, consultant, and you simulate that you talk to him in a phone. Okay, so for 9 minutes you are talking to the examiner in a SBAR form. Hello, I'm Dr. Reda Harbi. I am one of the ST3 registrars working in St. George Hospital. Can I confirm, am I talking to the vascular consultant in Castle Hill Hospital? Yes, you speak to this consultant. How can I help? Thank you, sir, for your kind response. Today I have a situation, background assessment, and my recommendations. I have this 20 or 96-year-old gentleman who presented to the hospital in the A&E with rupture AAA. After stabilization, we have his, this patient is on a background of past medical and surgical history. Assessment, examination showed 1 to 3, history showed 1 to 3, and the laboratory and imaging showed 1 to 3. This is the situation. This is the situation, and the assessment, we said laboratory examination findings, laboratory findings, and then for this reason, this patient is septic and imaging CT angio being requested. He is, by the way, hypokalemic, and we have spoken to the renal replacement therapy team or renal team or medics to adjust his potassium. They will give him 40 millimole per liter KCl over 48 hours or over 24 hours. And after stabilization, my recommendation is to transfer him to the vascular unit. Thank you, doctor, but what about his potassium? Okay, I don't remember the potassium. I don't remember potassium. Tell him, give me a few seconds, I will have a look. You have another copy, situation, background, assessment, and recommendation. And he will start initiate your registrar rules. Like, no, but there is no beds available. Don't tell him, okay, I will talk to another consultant. Don't do that. Give him, show him yourself. Show what alternatives you've got. Like, thank you so much. I will speak to the ITU registrar. There might be patients who are in the ITU, can be stepped down to the HOPS, high observational base, or to wards, or some ward, or I will call also to the ward doctors to start discharging the stable patients. Also, I will talk to the bedside manager. he will start to think that you are a good registrar. You are not saying, I can't, I don't know. You have alternatives. Okay? Angry patient, how to approach, breaking bad news, how to approach. All of that will be well covered in our communication sections. So, better understanding of each station with some mocks, open discussion, 24/7 support, how to answer each station, tips and the tricks for professionalism marks. Many people, Dylan, he failed in Edinburgh. He has been in another groups and a lot of things. He came, I told him 1 to 3, you have a problem in 1 to 3, professionalism, you failed because 1 to 3, you are a bit direct and aggressive, you don't reassure patient, you don't sympathize, like, okay, doctor, my father did yesterday, and I'm really worried. Okay, don't worry, but what about your mother? Has she died? So you should feel the patient. You should, oh, I'm really sorry to hear that. That must be very painful for you, isn't it? And you smile, yeah, yesterday, but, and then you say, doctor, but I'm reluctant patient. Doctor, no, you need to examine me. So, no, don't say no, I will not examine you. There is sandwiching, burger. That sandwiching is to tell the patient that you appreciate him, understand his thoughts, all right? Then give him the bad fact, clear fact. But the medical approach is to have full history taking and then full physical examination in order to direct myself for specific diagnosis and then specific treatment accordingly. Is that all right? Is that acceptable for you? Are you following me? Then, after the bad fact, give him the third layer of the sandwich, burger sandwich, which is, don't worry, you are in good hands. You are not the first patient in the hospital came with this disease or whatever. So understand patient's thoughts, tell him clear fact, then tell him you are in good hands and more reassurance to close the loop of communication. This one website, the Royal College website together, and just watch their SoundCloud podcast. Just watch them. You will be amazed. They have a system, and I do respect, by the way, systems, because at the end of the day, you don't know what to do. You need to follow algorithm, clear algorithm, which is for all. All follow the same algorithm. That's why they hunted all surgeons around the world by their system, right? So all my recommendation for you is to be systematic as well, to understand what is the meaning of professionalism, ethics, and how to show communication skills, and also the okay, so go to, for example, course faculty history, course order history. Then you need, after this, you can go to this one course. And I finished it in 2019. Okay. So just do CRISP if you have the chance to. Okay. Then you will take this certificate. That is mandatory for you to have, like, start as a registrar. You need to show this competency. So be encouraged to ask me any question and start understanding the Royal College podcast on SoundCloud. I will give you the link. You need to have full access to mocks. So we'll give you the official notes, weekly live mocks, 24/7 support until you pass. I hope you enjoyed this small session, and God bless you all, and thank you so much, and I hope you enjoyed.